According to the Levels and Trends of Child Mortality Report of 2015, 2.7 million newborn babies died in 2015 across the world, with an additional 2.6 being stillborn. It is therefore important that skilled health professionals attend all births, as timely management and treatment can make a difference between life and death for both the mother and baby. It was against this background that the Community Working Group on Health, CWGH, in partnership with Ministry of Health and Childcare, implemented a 3-year project on strengthening community feedback mechanisms in health in 3 districts in the Matabeleland provinces of Zimbabwe, with support from the European Union. The districts are Umguza, Umzingwane, and Wuwi. The program involved capacity building trainings for men as agents of change, monitoring and support, supervision, refresher courses, and district stakeholder meetings.
We have been able to have, a critical mass of community volunteers. And these are community volunteers that are knowledgeable, community volunteers that are well informed about health issues. As a result, they are able to hold authorities accountable. They are able to demand for their health rights as enshrined in the new constitution. They are able to collect community views, make sure that community voices are heard, both in health planning and in implementation.
One of the key priorities by the committees as a result of a feedback received was the need for improving facilities for expecting mothers, which has been achieved through the construction of mothers' waiting homes.
Thina sibona kuqhakathekile ukuzolindela basi-advise ngokuthi ukubhalisa kulesikhathi kuqhakatheke ngokuthi umntwana baqalelela ukumcheka masinyane ukuthi akala problem.
I-advantage ukuthi nxa usuke ekhaya isitho sibuhlungu sesikhathi kungenzakala ukuthi ubelethele endleleni, but nxa silapha kungcono because ngabuhlungu athola uncedo masinya.
Omama sabathengela ukudla ukuthi kuba kwanisa ukubakhuthaza especially ngesikhathi sendlala. Omama babekhala ngokuthi bangeke babuye la ngoba emakhaya indlala iyabikhona, so uyabe ngeke azacupha kuyimputshana okukhona ekhaya, so ngcono yahlala ekhaya bese kudaleka ingozi yokubelethela ekhaya. Sase sihlala phansi njenge-HCC ukuthi cebo bani esingalenza ukuthi abantu kungabi lezi ngozi zokubelethela emakhaya. Sathenga ukudla, omama babe sebebuya sibilokuzwayo.
Khathesi CWGH basibuyisile lapha bangenela ukuthi kufanele kube labantu abangathatha information ngale ukuthi sikwazi ukuthi bangahamba ekhaya beyebuza umuntu esekhaya bafika bambuze uhambe uphathwe njani eclinic bakhulume yonke into. So thina nxa sithola iproblem siyahambisa phezulu kubodeno.
Ama projects esesiwenzile eKumbuzi Clinic siyanelisile ukuthi ngemali esitholayo siyakhe senzele omama i-mother's shelter ukuthi bezokhululekela bezolindela behlala khona lapha eclinic. Okunye esikwenzileyo sibayakhele lekitchen ukuthi nxa bekhona bengakhathazeki ukupheka.
The project works directly with health center committees, men as agents of change, community monitors, health literacy facilitators, and community leaders to strengthen community feedback mechanisms for improved quality of health services.
silama community monitors, HLF, omeli mobilizer abanelisa ukuthi ngoprogram leyafikayo banelisa ukubhoda ngezindawo kuma village ethu behamba befundisa abantu ngezengculaza, ngezokuphathwa kwabantwana, ngokuqakatheka kwabomama abazithweleyo, kungabi khona lokhana okwezalukwazi okuthiwa umuntu uyasikwa uyabelethiswa sika inkawa ngereza.
Khathesi silama suggestion box ukuthi sikwazi ukuthi thina vele sisebenza senza njani nxa abantu siyabatshela futhi la ngamalungelo abo befika eclinic ukuthi bona abantu balelungelo bani bese clinic.
Siyabuthanisa omama abapregnant abazithweleyo bodwa abangaba senanini abangu-12 sixoxisane labo sibabuza imibuzo yokubana uncedo abalutholayo lapha eclinica luyabasuthisa na. Sivama ukuthi sibuze isikhathi sokuvulwa lesokuvalwa kweclinic ukuthi basuthiseka ngaso yini. Siyababuza ukuthi bayathola yini imithi yonke abayabe beyilandile ukuthi bezozizwa usizo.
Akakhulu sekulomehluko khathesi abantu abaningi babe ngabuza ubhalisa ngesikhathi bethanda ukubelethela emakhaya into engaze ibelethe kazihluphile ukubisa umntwana esibhedlela cina begula abanye besifa. Abantu akathesi sekulomehluko sibili abantu abaningi sebebuya esibhedlela sebekuthakazelela ukubuya esibhedlela.
They came up with the situation of having the suggestion boxes whereby whenever there is a problem in the community, they write a letter and drop it in the suggestion box. When there is a meeting with the HCC, then that letter is read, whether the nurses, they've got a problem with the nurses or the patients. That letter is read. Wherever there is a problem, then the HCC can talk to us if ever they are doing the wrong things.
Khonapho sithatha imibono ebantwini sabe sebenzisa i-scorecard. Singathatha imbono leyana sikhulumisana labo mama abazithweleyo, labo mama abasanda kubeletha, le community nje sichasisela ukuthi umama kumele angabelethele ekhaya, kumele abuye esibhedlela azolindela njoba kule mother's shelter, ahlale ku mother's shelter abelethele eclinic wenzele ukuthi sinqabele ingozi yokufa komntwana lo mama ezithwele.
60 men were identified at community level and trained as agents of change from the 3 districts targeting 20 health facilities. The training empowered the men to promote the utilization of neonatal and child health services and effectiveness of the community feedback mechanisms and educated them to influence positive health-seeking behavior.
Obaba sabakhuthaza ngalindlela ukuthi baqhube omama bebuye lapha. Sathi baba, umama ngabuya abanje ukuthi uya. Uza nathi ukufihlela wena ungazi. Asambeni sontweni owenzela ukuthi umama ekhansilwa lawe baba ukhansile nxa usuba nje umkhuhlane ubonakala ukuthi kuyakhansilwa inathi livikele lonke.
Bakhuthaza amakhosikazi abo ukuthi banakekele izimuli zabo ikakhulu omama nxa ngesikhathi ezithwele. Simkhuthaza ubaba ukuthi akhuthalele umama ukuthi ayibhalisa within 12 weeks okungaba izinyanga ezintathu. Abhalise ukuthi esengumuntu ezithwele ukwenzela ukuthi umama lo athole ukuhlolwa emzimbeni wakhe.
In ANC as well as PNC, most ladies or most women, they are bringing up their husbands when they come for first bookings, even up to the end. Even if they are waiting here at the waiting mother's home, the males also partake in bringing them food, water, as well as even bringing up their toddlers, so that if these pregnant women miss their toddlers, they also see them. That even motivates even those who are giving birth at home. Now they are giving birth here at the Royal Health Center.
Sitshenisa abantu ukuthi nxa umuntu egula ufanele esibhedlela. Loba ehamba kuzinatha kodwa ufanele esibhedlela ngoba ayekhangelwe ingaphakathi yakhe. Umsebenzi sikhuthaza abantu ukuthi baye esibhedlela.
District stakeholder meetings were conducted where clinics had an opportunity to share their challenges and make recommendations. Issues such as shortage of staff and medicines for chronic illnesses and water challenges were raised in these meetings.
Sihlutshwa ngamanzi kakhulu lapha kana thina abanye ngigogekile mina ngikwanisa ukuhamba usizo ngagula ngihlule kube ngithwele isigubhu samanzi ngibeklinika lapha ibengicela ukuthi ngatholakala usizo sizakale schedule masinyana amanzi kakhulu nesezigoga.
Then other feedback maybe that looks at issues of water and sanitation, issues of maybe like emergency services, ambulances, of road networks is discussed during district meetings that we hold, where we invite different stakeholders, including the RDC, maybe the Ministry of Roads, and the District Water and Sanitation Committee. So normally feedback is given to them and then they action through maybe providing services or doing repairs here and there where necessary.
We have got even the health literacy facilitators, and we are getting the feedback from the community about the staff, how the staff is handling the patients in terms of the patient's charter. Are they doing things satisfactory? Okay, and also we also get information pertaining to the clients themselves, how they are handling themselves when they come to the hospital. And I think in that regard, we are satisfied because what they've actually brought as feedback from the community, we have also investigated, and some of the things we've found that they are true.
With community feedback mechanisms, we have been able to have a vehicle for information flow, both from the health facility to the community, and also from the communities, to the institutions. And we see this program as a catalyst in terms of bringing, community ownership in health processes.
The project works closely with rural district councils in the 3 districts who are the custodians of the health centers.
There has been a great change in people coming to seek services at health centers. There is a great improvement, even on maternal deaths. Specifically, I'm referring to deaths of either mothers who come to deliver. The numbers have decreased. Even the numbers of children, young children, the under 5s, who were passing on before the coming on of CWGH, we realized that there's a great improvement. The communities now understand the importance of seeking health services on time, especially the expectant mothers. Yes, they now go and do the antenatal and even the postnatal services. They are being sought at a greater level. And we are having very few home deliveries. Unlike previously, there were so many home deliveries, and these home deliveries would result in either deaths of the mothers or deaths of the children. But we are very impressed that at the moment there is quite a significant change.
In the past, would notice that when maybe the health facility needed the community to come and assist, maybe they are building something, or just for, general maintenance of the health facility, there was very poor participation of the community. But with this program, people feel like they own the health facility. They are part of the health facility. So there is a great improvement in terms of, they are coming and participating and, owning the things that are actually happening in the facility. So in a way, I think in the 3 years that we've been implementing this project, we've seen a great improvement in terms of community participation. We've seen a great improvement in terms of, in terms of relations between the health workers and also the community. in the past, when you talk about a health worker, people will tend to think, they are not friendly, this is how they treat us, they shout, they say all these bad things to us. But now, people are free, they come to the health facility because there is actually, the nurses and the health workers are actually friendlier to the community.
At provincial level, the project works closely with the Office of the Provincial Medical Director of Health.
We've noted quite a number of improvements with regards to some of our maternal and child health indicators, since this was an area of focus for them as well. We've noted quite a marked reduction in number of home deliveries. We've also noted a number of an improvement in the ANC bookings, which were low. We find for some of the facilities, they have noted reductions from as many as 41 home deliveries in 2013 up to as low as 27 now. So it's work in progress within these communities. They've worked to strengthen health center committees within our districts, which have been key players in how we've been offering our services. You find all our clinics now having health center committees, which assist in the runnings of the institution and assist in mobilization of resources where there's a gap. They also assisting us in regards to what kind of services we're offering and what the community requires from us. So you find the strengthening of these health center committees has been a positive, because it has also increased community participation in the services that we're offering as Ministry of Health. So you've, for those that have been working with community working group, particularly in Umzingwani, they've also highlighted that you find there's more improved ownership of the services that are being offered. So where before you would say we don't have resources for example, medicines in the clinic, through the health center committees, they're able to resource mobilize, to also assist and say, let's move forward with our clinic with regards to procuring medicines, improving this infrastructure within our facilities. You even find some health center committees going as far as constructing accommodation for staff members.
The media was also involved through workshops in which they were conscientized on the project and assisted with improving coverage of health accountability issues.
As you know that HIV and maternal health you cannot separate, because if I'm pregnant and I'm HIV positive, I'm a special mother in terms of service provision, in terms of nutrition, in terms of protecting myself from new infections, STI and the like. So we have been really working with Community Working Group on Health in terms of engaging the media on positive reporting, and also to give them the correct terminology in terms of the program, because we also realized that in HIV, the key driver, one of the key drivers of HIV is stigma and discrimination. So we want our journalists to report non-stigma information to the community, to be more positive, so that at least even if you are living with HIV, as you know that our first case of HIV was in Zimbabwe, was discovered in 1985, and to me that's more than 30 years. And we are saying at this age, you don't want people to be still moving with stigma and discrimination. And I believe that it can be better as long as we are going to continue engaging and working together with Community Working Group on Health. I'm sure it can be better.
The project advocates for increased resources for maternal, neonatal and child health services. Lobbying was done through the Parliamentary Portfolio Committee on Health and Child Care.
I still remember a number of workshops that we did with CWGH looking at the budget performance levels. We have also worked with CWGH in terms of pushing for legal framework in the health sector. The public health bill, for example, CWGH is one of those partners that played a critical role in ensuring that the life of this term will see that bill being getting into law. But beyond that, CWGH, we have been working with it in also ensuring that in overseeing, generally overseeing the health facilities, for example, the
The project empowered communities on their health rights and responsibilities for increased access and utilization of maternal, neonatal, and child health services. It increased male participation and involvement. It also increased knowledge on patients' rights and responsibilities using the Patients' Charter. Various platforms were developed for the community to share challenges, issues, complaints, and compliments for improved health service delivery. It improved communication between the community and health workers, increased community participation for improvements in the health delivery system. It instilled a sense of ownership as communities are now spearheading development initiatives in the clinics. Feedback mechanisms were developed through introduction of suggestion boxes, use of scorecards, and engaging with various cadres through health center committees and health literacy facilitators. Over the past few years, the CWGH has managed to influence a number of health-related policies using platforms such as the CWGH National Conference, the pre- and post-budget meetings and high-level advocacy meetings and engagements with officials from the Ministry of Health and Child Care, Finance, and the Parliamentary Portfolio Committee on Health and other civil society organizations. It is through such engagements that CWGH managed to influence the enactment of the long-awaited Public Health Amendment Bill, which was signed into law in 2018 after almost 8 years of advocacy. The new Public Health Act provides for the rights, duties, powers, and functions of all parties in the public health system, provide for measures for administration of public health, and repealed the 1924 Public Health Act.